All right, good evening, everybody. Dr. Matthew here at Evolution Chiropractic. It's a little bit before 6, but we're going to start talking about ear infections and what individuals can do to either recognize them early, but also how to navigate them naturally. So we're going to jump right into this. Let me see if I can find this window. Where's the window? Here it is. All right, so let's talk ear infections and how we can manage them. So I'm using a platform called Restream, and I've never used it before, but I'm digging it. All right. So, let's talk ear infections. So it's no accident the most allergic generation in history has been raised on antibiotics. This is a MD, Leo Galland, said this. And often that's the first go-to that many people have for ear infections. Many MDs say here's an antibiotic, but there is a downfall of that. One is if the ear infection is viral, then an antibiotic is pointless. With some of the research that I'll share with you, sometimes the antibiotics are unnecessary. So I hope I'm live on Facebook. I don't know if I am. I think I am. Cool. All right. So let's talk first about the ear anatomy. So ear anatomy, there's an outer ear, a middle ear, and an inner ear. So the outer ear is kind of what you can touch, right? It's this auricle or this wing. Then you have your middle, kind of like, it's not your eustachian tube, but it's where you put a Q-tip. You have this, and then the middle ear is the think of the bones. There's 3 little bones, and ossicles or malleus, incus, and stapes are the bones. And then you have your inner ear. Your inner ear is actually your cochlea itself. And then your eustachian tube kind of drains down. With individuals who are young, your eustachian tube is more horizontal than it is vertical. So the reason kiddos often tug on their ear is because the eustachian tube is not draining and they're trying to get it to drain. So that's just really brief ear anatomy. Let's talk about actual ear infections. So there's 3 different types of ear infections. There's otitis media with effusion. There's acute otitis media, and then there's chronic otitis media with effusion. I'll talk about each of those individually in a moment. How to diagnose ear infections. One is through a history, and so this is going to go from least invasive to most invasive. So least invasive, how to diagnose an ear infection is through a history and physical exam. So you're talking to the parent says, hey, there's been a fever, there's been runny nose, baby's been pulling on their ears. You're painting a picture to maybe a diagnosis of an ear infection. And then there's the physical exam itself. So the pneumatic otoscope is a tool that many individuals, doctors, as a chiropractor, I'm allowed to use this as well. It's an otoscope that you actually look into the ear and you look at the tympanic membrane. So think of the tympanic membrane as a sheet. It's a gray or clear-like sheet that covers the middle ear. Really what doctors are looking for is, what does that tympanic membrane look like? Is it bulging? Is it retracted? Is there, pus? Is there a hole in it? So that's really what we're looking for when we're looking in kiddos' ears. In addition to, is there wax buildup, or what does the ear tube itself look like? And then the most invasive thing is actually figure out is, take a culture of the ear. Is it a viral infection or is it a bacterial infection? So let's look at 2 versions or 2 images. So on this left side, or my left side, is a retracted tympanic membrane. This is often a viral infection. This is otitis media with effusion. So again, you can see on the image, you can really see those bones too, like they're almost like, again, the tympanic membrane is retracted, so you can see a lot of it. The other side is a bulging tympanic membrane. So again, you can't really see the bones at all, and you can't even see that clear tympanic membrane itself. It's just too bulging. That's more of a bacterial infection. Let's talk about risk factors. So who gets ear infections? Well, the quote that I used yesterday, or maybe it was yesterday, was, 5 out of 6 kids are going to get an ear infection before their 3rd birthday. So a lot of kids will get ear infections. A lot of times it's because of the time of year. So temperature drops and or fluctuations in pressure of the air can often lead to an ear infection. When kids start to swim more, this is often when you'll find ear infections start to happen. And again, wintertime. Dairy consumption is another one. So kids, and this is actually interesting. So I was reading about this yesterday. Raw dairy consumption actually has a least likelihood to allergic reactions and what's the word I'm looking for? Congestion, right? So if individuals are drinking raw dairy, this is a very, very low factor. But if you're drinking pasteurized dairy, then this actually increases your risk for congestion and for allergic reactions. Feeding positions can impact risk factors for ear infections, lack of breast milk. So when babies drink breast milk, they're often getting antibodies from mom, or they are getting antibodies from mom. So lack of that breast milk can increase the risk for an ear infection. Individuals who have a smoker in the house or who are taken care of by someone who smokes, maybe they have smoke on their clothes and they're getting the secondhand smoke transferring. Fetal alcohol exposure, daycare exposure. While daycare exposure is okay for kids, right? It's good to interact with other kids. Your immune system is going to be working quite intensely at a daycare, which is fine. But just know kids that go to daycares often get ear infections more often. Cranial abnormalities. So this term right here, cranial abnormalities and vertebral subluxation. So this is really what I'm looking for. So when I look at individuals that have ear infections, I'm looking at the cranium, so the bones of the head, which I'm going to grab. So I'm looking at the temporal bone itself. I'm looking at the occiput itself, and then I'm looking at the sphenoid. So I'm looking at all three of these bones to see how they're moving with one another, because any pattern or tension pattern within these bones can pull on the ear and can pull on the temporal bone. So here's the temporal bone. This hole right here is where the eustachian tube is. And so again, any tension patterns that's happening there is where I'm looking. And then you got to think of the upper neck. So a lot of the nerves that innervate the ear and innervate the muscles around the ear come out of our neck. So if there's any tension patterns in there, maybe whether it's through birth trauma or, maybe the kid really likes to look to the left, or maybe the kid has a head tilt to the right or whatever. I'm looking at those, and that's where the chiropractor is really going to start to work with the individual. Nutritional habits. Nearly 50% of cases of otitis media are preceded by a upper respiratory tract infection. So most likely if a kiddo has an ear infection, they probably had an upper respiratory infection within the past couple of days. And then prior episodes of otitis media. So if your kid has had ear infections once, they're most likely going to get it again, or there's a risk factor. This is just epidemiology so epidemiology is like how it happens, who gets it. So anywhere from 6 to 2 years of age, 6 months to 2 years of age. Again, it presents with low-grade fever, fussy, tugging at ear. There can be mild hearing loss. If you have an otitis media with effusion, so viral, if you don't get that, if you don't focus on opening that up or kind of navigating that naturally, that can develop into acute otitis media. And then that can develop into chronic otitis media. And that is not a good sign. You don't want it to keep developing and keep developing. If that happens, you do run a higher risk of possible hearing loss or rupture of the tympanic membrane. Typically, though, otitis media with effusion typically resides within 3 to 4 days with no major complications. So a lot of people see that they have an ear infection happening, they go to a medical doctor, the medical doctor immediately prescribes, not all the time, but sometimes will immediately prescribe antibiotics, when in reality, it could have just run its course. And I'm going to talk about some antibiotic stats in a little bit. Acute otitis media, so this is more of the bacterial. Again, infants to 5 years of age, the peak is between 6 months and 2 years. This will present with high fever, yellow pus, intense ear pain. This can call for antibiotic treatment in some cases. However, there are some studies that prove management with homeopathic remedies manage this just fine. So just because I wrote down it does call for antibiotic treatment, doesn't mean you can't use homeopathy to remedy this. Let's look for watchful waiting. So 75 to 90% of uncomplicated otitis media or ear infections resolve within 2 months without antibiotics. Doctors in the European countries utilize a wait and watch approach before prescribing antibiotics. They've documented that nearly 60 to 90% of cases of earaches resolve without any treatment at all. You can just let it be. Now, 2 months is kind of long, right? You wouldn't want your kid hanging out for 2 months, with nothing. But you can navigate that if you're open to working on it, if you're open to some lifestyle choices and for some palliative measures. So palliative measures meaning, how can I help my baby feel the best in their body? Can I help them open their eustachian tube? Can I help them kind of work with the temporal bone? Can I bring them to a body worker or a chiropractor or, someone who knows herbs to help them navigate this? So manual therapy. So this is where I would come in, right? So chiropractic is a really beautiful approach to ear infections conservatively. So low force adjustments. Again, with kiddos, we're not cracking a bunch of bones. I'm not rotating their neck a bunch. I'm really just holding sustained pressure in their cervical spine and doing some gentle, very gentle manipulations with my fingers. Again, I'm focusing on occiput itself, and I'm focusing on the first kind of 3 bones that come down. And I'm also looking at the TMJ. So the TMJ is where the temporal bone, right, where the mandible and the temporal bone meet. So this is your TMJ. So it opens like this. It opens like this. And a technique that I'll often use is called a galbreath technique. It's an osteopathic technique where I'll actually be holding the ear and I'll be dragging down on the mandible, and it'll actually open up the eustachian tube. A more invasive approach is called the pharyngeal sweep, and it's actually where I would go into the mouth and I would sweep the inside of the throat. That can be kind of intense. Most kids do not like it. However, it can really clear up that eustachian tube. If you want this PowerPoint, let me know and I'll send it to you because these links are clickable. By addressing the biomechanical compensations of the body at first sign of earache, we allow the body to better optimize its own ability to manage the inflammation. So there's no adverse side effects when you do this, right? It's not like you're going to hurt the individual. It's not like this is going to make the earache worse. But by seeing, hey, my kid's tugging at their ear, hey, there's, he had a respiratory infection a few weeks back, that's your sign to come get the baby checked and to start opening up that eustachian tube. So this is the galbreath technique. This is what it looks like. Again, holding the individual's kind of temporal bone or their ear and then pulling down onto their jaw. If there's any questions, please feel free. I do have Facebook open. I'm going to try to kind of watch it. All right, so antibiotics. So if you want this, I can send this to you, but antibiotics have the ability to lead to the development of antibiotic resistance bacteria. So think about it. If your kid has a viral ear infection, what's the point of antibiotics, right? Antibiotics, bacterial. So if it's viral, an antibiotic is not going to navigate. It's not going to do anything. There are associated adverse physical side effects of antibiotics. So although they can be beneficial, they can also have adverse side effects. So you got to think, what is an antibiotic's job? It is to destroy bacteria. While that is great if there is a massive bacterial infection, your body is full of bacteria. And so if your body is full of bacteria and you're taking an antibiotic, you're destroying good bacteria that the body could be utilizing to then clean itself up or to then feed other bacteria to then clean itself up. Otitis media ear infections are a self-limiting disease, right? This means the condition will run its course and resolve over time. Now, I don't want to diminish anybody that has had their kid with an ear infection that doesn't get better and they have to get tubes. That sucks. But we have to think, were the rounds of antibiotics necessary? Could we have just watched this thing? Could we have used garlic or mullein, or could we have done different things to kind of can navigate that? And I don't know. 9 out of 10 children diagnosed with middle ear infections will receive an antibiotic, which is huge. I do believe, of the parents that I've seen in the office, many medical doctors are waiting, but they will often write a prescription just in case. And so here's the thing. When they write a prescription just in case, you're more likely to use that prescription. So just know that. Again, this is just talking about the destruction of bacteria. There's a cool thing about antibiotics and gut health. Antibiotics inhibit neutrophil. So the neutrophils are these white blood cells that destroy bacteria. And so when you're taking antibiotics, it's limiting that ability for the white blood cells to go do its job, right? Your body was made perfectly to then navigate these types of things. This is how we've evolved over time. And yet man has thought, hey, let's do these things. Well, antibiotics are great for these massive bacterial infections. For ear infection, I don't really think they're that, they're great. I don't think they're that great. Long-term use can contribute to neurological impairment and developmental delays. Length of treatment. So here's what I talked about earlier. So There's no evidence in the medical literature that shows taking an antibiotic for 3 days, 5 days, or 10 days is more or less effective. And of the parents that I've seen in practice, they've all been written 10-day scripts for antibiotics, which means the medical doctor said, here, take these antibiotics for 10 days. When that's not based on anything, because there's no literature that says, well, they could have taken 3 days worth of antibiotics and it could have done the same thing. When used wisely, antibiotics are a very valuable asset to in the medical field. And if you must take an antibiotic, I would say do so with some lifestyle changes. So nutritional support. So start to eat non-inflammatory. Make sure your kids are eating non-inflammatory or not being exposed to a lot of inflammation. And then utilize a probiotic before and after the course of antibiotics to kind of regulate the gut bacteria. And then high dosage of ascorbic acid could be really beneficial. I think there is a link for that. Yep. Excuse me. So there's a link in here, a video of Susan Humphreys and vitamin C. She talks a lot about ascorbic acid and how to utilize vitamin C in a really, really great protocol. So utilize it or click on that if you want it. I'm going to see if any questions have popped up. Cool. What else? I think if you're going to utilize antibiotics, use a conservative approach. And then I would also advocate that if you know a little bit about your body, so if you know, hey, this is my temporal bone, and within my temporal bone is my eustachian tube, and my kid is pulling on their ear, that's recognizing that the body wants to open. So if you know that, then you say, all right, little kiddo, I know this really cool technique that Dr. Matthew taught me. It's in my email because Dr. Matthew makes a lot of videos for individuals. I'm going to watch that and we're going to do it. And if it doesn't work, then we're going to, maybe take you to Dr. Matthew so we can get your neck checked. If we immediately go to a pill, if we immediately say, here, Timmy, take this pill for your ear infection, we're devaluing our body. And then little kids will start to think, well, I can't heal without this pill, or I can't heal without this shot. And that's starting like a very, it's not a good start for kids to start to realize the bigness of themselves and the bigness of their body and how beautiful their body is designed. So if we start to say, hey, your body's got this, let's get your body opened up. Let's make sure your brain can talk to your body. Let's make sure you're not subluxated and make sure all the tension is away from your neck so that your body can heal. Then the kid will be like, yeah, my body can heal. I can do this. I made this. So these are some sources that you can check out. I made this PowerPoint for an individual who was in dental school when I was in chiropractic school. And she had a lot of questions about chiropractic and, is it really worth it? And, what about ear infections? She brought this up. And so I made this PowerPoint for her. And so I just want to explain to you guys that chiropractic is not only a science, it's not only an art, but it is a philosophy, which means we view the body, we view healing as principles. And when healing is a part of your lifestyle, when healing can be viewed as natural, we start to recognize that. Medical doctors are always looking for pathology, which means if you take anyone into an emergency allopathic position or office, they will find something. They will say, yes, this is what's wrong, or this is what's wrong, or we need to do this test to give you this diagnosis. When that's the case, they're always going to have a pill for that. If you bring your kid or if you bring yourself to me, I'm not going to be looking for what's wrong. I'm going to be looking for what's moving and grooving right in your body. And I'm going to say this area could use some support. But guess what? That's really simple. We can adjust that. We can give you some skills. We can encourage you and educate you on some lifestyle things that you can do to open yourself up and stay open, right? And when you do that, you feel more empowered. And when you're more empowered, you're more likely to take better care of yourself versus I'm sick. Where's the pill? Great, here's the pill. Now I'm better, or my symptoms are gone, so I must be better, when that's not necessarily the case. So a couple things just off the top of my head as far as what you can utilize right now if your kiddo has an ear infection or showing signs of ear infections. One is garlic or mullein. Sometimes this comes in a tincture. It can be applied to the back of the ear. It can be applied into the ear. The next thing is called the galbreath technique. This can be done at home. Really simple. It's basically holding your kiddo's ear with a slight pull and then very gently opening their jaw. When this is done, it can relieve a lot of pressure. The next thing I would say is bring them to me and let me check them. Let me check their neck for any tension. I may say, hey, there's no tension and you're okay. I may say, hey, yeah, there is some tension and we should adjust this. And if we do that, it's going to be an honoring and it's going to be very gentle for your kiddo, because most kids are like, yo, who's touching my neck? But most kids, once they get adjusted, they really like to get adjusted, and it starts to feel good in their body. And they start to feel like, hey, this is my body. I can do this. So hopefully this answered some questions. Hopefully this, was able to, hopefully this was able to stir up some questions for you. If you have questions, please ask. I don't see any questions on Facebook, so I'm going to end this. And I appreciate you all taking time to watch this, and I will post this later. Cheers. Ooh, how do I end? End.